Air Act, which is credited with cleaning up the air we breathe while preserving American competitiveness. He fought for the passage of the revolutionary legislation, such as the Endangered Species Act, as well as laws that address America's most pressing needs, like the Children's Health Insurance Program, which is CHIP, and the Mammography Quality Standards Act. May I please present our Congressman and my friend, John Dingell.
Good morning. Great to be here this wonderful day, and I know it's a little cooler too. I don't think anybody here objects to that, do they? Well, it's wonderful to see you all here this morning. I'm delighted to be here to be with Representative Dingell. She serves us so well. And Deb, thank you for what you're doing for us at the Lansing. I'm proud of her, and I'm proud of what she is doing to provide real leadership for the people out in Lansing, to look to the well-being of senior citizens, the protection of our environment, the looking after consumers. All of these things are important to us, and important not just to seniors, but to our kids and to the future of the country. So Deb, thank you for what you do, and it's a privilege to be here with all of our friends to share with them some of the great things that you have done for us. And so we are celebrating right now two great events in the history of the United States. The first is Social Security, enacted into law under the leadership of President Roosevelt and under the sponsorship of my dad. If you'll look, you'll see a little skinny Pollock with a big broken nose and a mustache, standing about 3 feet or 4 feet behind President Roosevelt when he signed that legislation. It was one of his proudest days. And if you look to see what it has done, it has accomplished prodigies for this station. It closed 1,100 old folks' homes and poor folks' homes in New York. And it did the same thing all around the country. And it allowed seniors for the first time to live in dignity during their retirement years. The other event we celebrate this week is Medicare. How many of you like Medicare? Let's talk about Medicare. One of the things of which my dad and I are most proud of. 45 years ago, we saw to it that the House of Representatives and the Senate passed into law, and President Johnson signed Medicare. Medicare has seen to it that senior citizens for the first time in history are able to live their retirement in dignity and have health and as a matter of right, not as a matter of privilege, something which is very important and something which we have just attended through this Congress. Now, every American is going to have health care as a matter of right and not only as a matter of privilege. But to talk of these things, Medicare takes care of more than, and Medicare and Social Security take care of more than 50 million Americans. 6 in 10 seniors rely on Social Security for more than half their income. 6 million children, more than 1 in 10, receive a major part of their family income from Social Security. Now, you're hearing a lot of stories about how we need to change Medicare and Social Security. I want to address that because I know those are of concern to every one of us here present in this room. Social Security is not running out of money. It is not contributing to the deficit. It has sufficient reserves to pay full benefits for about 30 years. And it does not need to be privatized as George W. Bush tried to do. And we are not going to let the minority leader of the House, Mr. Boehner, or Mr. Ryan privatized Social Security. They tried it in 2005, and guess what they did? They did it just 3 years before the market collapsed in a depression presided over by George W. Bush. And had you had your Social Security invested in the stock market, you'd been like a lot of people who have 401ks and who now don't have money in those 401ks. Because your Social Security monies are invested in the safest securities in the world. United States government bonds. And we're going to see to it that that's going to blood. We're going to see to it that there's no privatization either of Medicare or Social Security. And now let's talk about something else that we care about, that's good for the country, and that we're going to protect. And that's Medicare. 45 years ago, President Johnson signed that into law. I was there to decide when he did so. I had been a sponsor and I presided over the House when we passed that legislation. And that legislation finally began to see to it that seniors could live their retirement years in dignity. And I will tell you that twice since I went to Congress, I've had to serve on commissions to prevent the privatization either of Social Security or Medicare. One of the things they tell you they're going to do is to help you, the senior citizens, by converting Medicare from the kind of program which it is, which is a defined benefit plan. Remember those words. And they're going to convert it into a defined payment plan. Now, what does a defined payment plan do? It shrinks over time. They give you the same amount of money every year, and because the costs go up, all of a sudden you find you don't have any insurance and you don't have any protection. We are not going to allow that. Medicare and Social Security are built on the promise that if you work, you're a good citizen, you pay your taxes, that you're going to live in dignity during your retirement. And we intend to see to it that that is done. You'll hear a lot of people complaining, usually who want to make changes, about how Medicare and Social Security are expensive. Well, let's look at that. Only 3% of the costs, or rather, let me say it differently. Only 3% of the funding of Medicare and Social Security are used for administrative expenses. Those are the most efficient way of delivering services in our whole society. Administrative costs for individual market and small groups are somewhere between 5 and 40% of your benefits. Clearly, we don't want that. Healthcare reform that we just passed extends Medicare's trust fund life for an additional 12 years. And it reduces the budget deficit by over $1 trillion. That ain't hay. Now, having said that, let's look at what the bill that we passed in Congress to provide health care benefits for every American does, particularly from the standpoint of senior citizens. First, it extends the Medicare trust fund for an additional 12 years. Second, it reduces the deficit by over $1 trillion, actually almost $2 trillion. It closes the Medicare Part D prescription drug gap. How many of you are in what we call the donut? Well, those of you who are, we're going to get a check this year for $250, and by 2019 we will have closed and eliminated that so that you won't have to worry about it ever again. How many of you are concerned about preventive care and seeing to it that you are able to get mammographies or pap smears? for a check about some of the other risks of cancer or heart attack or things of that kind. Well, the health care bill we passed this year eliminates all cost sharing. That's co-payments and deductibles for preventive care.